So good morning to all of you. Kasi may naka-record tayo, no? So we'll start the discussion with beta-lactam compounds. So we'll skip to that now. So as we all know, penicillin, cephalosporin, and carbapenem and monobactam have a similar backbone, no? So it has a beta-lactam ring that carries the secondary amino group, which is easily hydrolyzed by beta-lactamase. So paki-remember lang yun, no? Beta-lactamase, no? The mechanism of action is that it inhibits bacterial growth by interfering with the transpeptidation reaction of bacterial cell wall synthesis. So this is the diagram that shows how beta-lactamase destroys yung cell wall. It is further classified into penicillins, anti-staphylococcal penicillins, and extended spectrum penicillins. Penicillins has a greatest activity against gram-positive organism, gram-negative cocci, and non-beta-lactamase producing anaerobes. And it is susceptible to hydrolysis by beta-lactamases. Kaya, mas ano na siya ngayon, what do you call it? Parang mas ano na siya, prone to resistance, no? And there are two types of PENG na ginagamit pa rin as of this date, no? We have PENG or benzyl penicillin. It is in the form of IV, and it is acid labile. Meron depot formulation, ibig sabihin yung parang pag depot, di ba, parang Wilton depot, ganyan, di ba? Once a month mo siya or parang binibigay sa'yo ng isang bagsakan, parang ganyan. So we have benzathine penicillin G and procaine penicillin G available as IM, no? And usually ito malapot to, and it is given or mixed diluted with peanut oil, no, to be administered. So next we have PENV or phenoxymethyl penicillin. It is taken orally, no. So it is a secondary prophylaxis for RHD, no, rheumatic heart disease. So penicillin G is a drug of choice for the following infections: streptococci, meningococci, enterococci, and many more, no? So it is also effective for beta hemolytics, streptococcal pharyngitis, and syphilis. Yung penicillin G. On the other hand, meron tayong isoxazosyl penicillins. So they are oxacillin, cloxacillin, and dicloxacillin. They are used for mild to moderate localized staphylococcal infections. So for example, yung mga pigsa, no? Yung mga skin lesions, no? May mga nana, ganyan, no? Na mukhang staphylococcal infection. Ito yung pwede natin bigay as first medication, no? Kunyari mga cellulitis, no? Ayan. So anti-staphylococcal penicillins are active against staphylococci and streptococci, but resistant to staphylococcal beta-lactamases. And there's a concept, no, methicillin resistant. So pag sinabing methicillin resistant, yung staphylococci resistance to oxacillin and nacillin. So, di ba, familiar kayo sa mga culture? So, pag di ba culture, ibig sabihin ko niya, wound or kahit anong specimen, no? ipapatest sa laboratory for appropriate antibiotic use. So, kunyari, wound, hindi gumagaling yung sugat no, sa ordinary antibiotics. So, ite-test yan. No? Tapos, pag doon lumabas, resistant sa oxacillin, no? Or nafcillin, ibig sabihin, MRSA siya. Hindi ibig sabihin methicillin resistant. Sa methicillin siya, may nakalagay na R. Kasi usually yun, kunyari, ang coamoxiclav, R. Ciprofloxacin, S. Pag sinabing S, sensitive. No? So, pag kaya methicillin resistant, that compound is resistant to something, to an antibiotic. For example, in this case nga, pag sinabing methicillin resistant, hindi methicillin yung hinahanap nyo. It's oxacillin or nafcillin. Okay? So, pag MRSA, ibig sabihin, methicillin resistant, staphylococcal aureus. Staphylococcus aureus. Or pag MRSE, ibig sabihin, Staphylococcus epidermidis. Okay? So, yan. So, let's move to the extended spectrum of penicillins. So, they retain the antibacterial spectrum of penicillin. However, but with improved activity against gram-negative. So, yung penicillins before, yung na-discuss natin, more on gram-positive. Pero, ito, with some gram-negative activity, pero hindi pa rin ganun kataas. Okay? They are also susceptible to hydrolysis by beta-lactamases. So these are the subgroups of extended spectrum penicillins, aminopenicillins, carboxypenicillins, and uridopenicillins. Aminopenicillins, so we have amoxicillin, very famous, no? And ampicillin. Since they are susceptible, no, to beta-lactamases, they are combined with other drugs, no, such as potassium clavulanic, no, for amoxicillin forming coamoxiclav, and ampicillin combined to sulbactam. Okay. So they are the ampicillin and amoxicillin are the most active of the oral beta-lactam antibiotics against penicillin-resistant pneumococci for the treatment of UTI, sinusitis, otitis, and other lower respiratory tract infections. So it is effective for shigellosis, treatment for serious infection caused by penicillin-susceptible organisms like the following. So dito, yung amoxicillin, eradication of H. pylori in duodenal and gastric ulcers. So as you can recall, no, amoxicillin is still part of the triple therapy. So naalala niyo ba ng mga nasa triple therapy? Triple therapy. Sino makaka-guess? Makakaalala. Triple therapy. Pag sabing triple therapy, saan ginagamit? Saan? Kailangan yata may additional points yata para sumagot ng mga tao dito. Ha? Uy. Ha? Triple therapy. Triple therapy. Na kung saan kasama si amoxicillin. Ibig sabihin kung triple therapy, edi tatlong gamot yun, di ba? Anyone? O assignment na lang. Sige, assignment na lang. Kung hanapin nyo yan, triple therapy, no? Para alam nyo ano yung ginagamot nun at saka ano ang components. Alam nyo, possible lumabas sa board exam. Carboxypenicillins. So, we have carbonicillin in the nilsodium and ticarcillin. Also, carcilline is also combined with the rescue drug, no, which is potassium flavulate. So carpenicillin is used for the treatment of UTI caused by the following organism. Pero personally, hindi pa ako nakakita ng ganitong antibiotic. Yung radiopharmaceuticals yon, si piperacillin and si mescluzine. Si piperacillin is also used for patients with pseudomodal, to cover for pseudomodal coverage. Also, yung piperacillin has also expanded nga, no? Expanded coverage for gram-positive and gram-negative bacteria. Ayan. So, nakalagay na pala dito, no? With expanded spectrum of activity against gram-positive and gram-negative pathogens, including most anaerobes. No? Especially for patients na merong immunocompromised, we give this type of drugs. For the treatment of pneumonia associated with cystic fibrosis and mechanical ventilation. So ako, ang tip ko lang din no, sa board exam, lagi, ang alalahanin nyo na lang yung mga drug of choice. Huwag na kayo mag-alala ng mga drugs na hindi naman masyadong madaling alalahanin. yung mga tingin nyo, parang ang mangyayari, fit on the shoes of the examiner. Itatanong kaya nito. Kung sa tingin niyo itatanong niya, di memorize. Pero sa tingin niya, parang hindi naman para i-memorize. Diba? In a 100 exam, diba? Imagine niyo with a large scope, hindi naman nyo i-expect na itatanong, kung mababasa o makakabisado niyo yan lahat. Okay? Yan lang, ma-sharing lang. Para lang ano, kasi baka naku, it is used for the ganun. Ako baka mataranta na kayo dyan. So, however, adverse effects includes also yung allergic reactions. Sa lahat naman yan ng penicillins, no, and other antibiotics, no, may mga talagang patients na may allergy sa iba-ibang antibiotics. And it can cause GI upset, especially in patients with patients taking large doses. Kasi imagine nyo, ang piperacillin tazobactam, binibigay yan 4.5 gram every 6 hours. No? So, ganun kadami. No? Also, ang ampicillin amoxicillin produces a non-allergic rash in the form of morbilliform eruptions in the extremities. Ampicillin is also known for pseudomembranous colitis. So, yan, no? So, cephalosporin and cephamycins. Ito, very board exam question yung mga dito, no? So, kailangan lang talaga. Kasi sa board exam talaga meron talaga 2 questions. Ito lang ang tanong niya. First generation, second generation, ganun. So, ito, familiarize na lang. So, ito yung mga, para lang magamit nyo to easily remember this table. No? So, first generation na may pa or pa. No? So, makikita niya, cephadroxyl, cephazoline, cephalexin, di ba? Second generation, and third generation, medyo nakakalimot to, no? So, dito, yung third generation kasi may on, 10, and 9. So, ayan, on, on, 10, ayan, centigluten, ito, except voxalactam, no? At saka ito, cefdinir. So, yan na lang yung mga parang medyo, I understand. Wala, sige, basta. Then ito, the rest, second gen na. Ito, cefuroxide, may 9 din, no? So, saka si lorocarbon, no? So, ito na lang yung mga kakabisa dun. For fourth generation, may P. Cefepime, cephiro, no? And fifth generation, myron, septaroline, and septomiprone, no? So, yan yung mga bagong generation of cephalosporins. So, ito, hindi naman talaga yung makakapagsabi, pero aralin nyo lang wisely. No? So, to differentiate them, no? So, first generation, more on gram positive talaga sila than gram negative. Second generation, mas increase na activity against gram negative, no? So, yung first generation, mas ginagamit siya for skin and soft tissue infections. Cefazolin, ito, drug of choice and also avoid exam question. No? Lagi yan. Drug of choice for surgical prophylaxis, cefazolin. Ito naman, second generation, bukod dun sa they have the increased activity against gram-negative microorganism, they have specific targets. For example, cefamandrol, cefuroxime, cefosinate, and cefuronide, and cefaclor, they are against Haemophilus influenzae. Cefoxitin, cefotitan, and cefmetazole, they are active against Bacillus fragilis. No? So it can be used also for the treatment of mixed anaerobic infection such as peritonitis and diverticulitis. Yeah. Also active against yung Moraxella cataralis and also for sinusitis, otitis media, and other lower tract infection. Usually, ang pinaka-most common na binibigay na second generation is cefuroxime, no? Relatively kasi mas mura siya. Yan. For the treatment of CAP, Klebsiella pneumoniae, Haemophilus influenzae, and other resistant pneumococci. So third generation naman, they are less active than first generation against gram-positive, but more gram-negative. Okay? So mapapansin nyo that as the generation goes up, mas nagiging increase ang gram-negative bacteria coverage ng antibiotics. No? Ceftazidime, especially ceftazidime and cefoperazole, they have additional property like pseudomonal coverage. Pag sinabing pseudomonal coverage, they have activity against Pseudomonas aeruginosa. Okay? And ceftriaxone and moxalactam active against Bacillus fragilis. Yeah, and also they have additional activity against beta-lactamase producing strains of Haemophilus and Neisseria. So drug of choice for all forms of gonorrhea and severe forms of Lyme disease is ceftriaxone. So usually we give a dose, no? Parang bolus dose. Pag kunyari, may mga tulo, ganyan. Binibigyan namin sila ng bolus po, dose ng ceftriaxone. No? Sometimes, and we give azithromycin as well, no? Parang prophylaxis. So cefotaxime and ceftriaxone are also the drug of choice for meningitis caused by H. influenzae, S. pneumoniae, SN meningitis, and gram-negative enteric bacteria. For CAP, yung CAP ay community-acquired pneumonia, nga pala, no? And for active strains against penicillin-resistant strains of pneumococci. So usually, pag kunyari yung patient sa ceftriaxone, we give, there's a term, meningitic dose. Pag sinabi meningitic dose, we double the dose for the patient. So for example, binibigyan namin na 1 gram every 8 hours yung ceftriaxone. Pag meningitic dose, ang target mo is for it to penetrate sa brain, no? we give it at 2 grams every 8 hours. Sa Tacitide, sinabi nga natin, no? Meron din siyang additional pseudomonal coverage, no? Kaya siya, the drug of choice for Pseudomonas meningitis. So, yun, sabi na natin yan, no? They are the drug of choice for serious infections like the following. Pag fourth generation naman, they have an extended spectrum of activity compared to third generation, and meron silang increased stability against hydrolysis by plasmid and chromosomally mediated beta-lactamases. So relatively, they are newer antibiotics. They're used for empirical nosocomial infections where where antibiotic resistance is owing to extended spectrum beta-lactamases. So ibig sabihin, if there's a nosocomial infection, ibig sabihin hospital-acquired na mga infections like pneumonia, we can give it as empiric therapy. Ibig sabihin, kahit hindi nila alam kung ano yung bacteria na yun, or if the drug will work out, itong fourth generation, pwede na natin ibigay. Kanyari, yung patient, clinically worsening, no? Pumapangit. Kahit hindi siya nakalagay sa culture, we can give fourth generation. One of them is cefepime. So cefepime is highly active against Pneumophilus and Neisseria. And also for Pseudomonas aeruginosa, Enterobacteriaceae, or used as pneumonia. Fifth generation, it combines the activity of the third and fourth generation, and an additional capability of these drugs are the activity against yung MRSA. No? So we have ceftobiprole and ceftaroline. So they have an increased activity against gram-positive MRSA. So ito yung summary natin, no? To memorize these all. So we have first generation, gram-positive coverage, no? Pag lumiliit, pag gram-positive or gram-negative, tumataas naman ang generation. And remember that the fifth generation or the advanced generation, no? We have ceftaroline, no? It is similar to to third and fourth generation, but we've added MRSA coverage. Okay? Ayan, isa pa. Para additional nyo lang din, no? Fourth gen is the water coverage din, no? Additional din yan. So let's move to the other beta-lactamase drugs. So we have monobactams, no? Such as acetaldehyde. So it is given to patients with resistance to most beta-lactamases, and they are active against gram-negative drugs like Pseudomonas and Serratia. So these sacrificial drugs, no, beta-lactamase inhibitors like clavulanic acid, sulbactam, and tazobactam, they have very weak antibacterial action, but they protect the penicillins from being hydrolyzed. Carbapenems, no? Ito naman, imipenem, meropenem, and ertapenems. They're used for mixed aerobic and anaerobic infections. For beta-lactam, it is a beta-lactam antibiotic of choice for the treatment of Enterobacter infections and the drug of choice for infections caused by ESBL. So, ano ba pag sinabing ESBL? It's a spectrum beta-lactamase producing gram-negative. Ano nga, for sure sinabi ko na yan before. Paano natin ma-detect yung ESBL? Resistance to at least 3 cephalosporin, no? Or pwedeng resistance to aztreonam. So, pwede natin bigay yan. So, pagka ganun agad yung nakita sa culture, hindi mo na bibigyan niya ng mababang antibiotic. Automatic meron pinag. Or, imipinin, ito na agad yung carbapenem sa agad ibigay. So, the most common adverse effects are the following, with seizures seen in patients taking imipinin. So, imipinin, yun, same activity as meropenem, resistance to, it is resistant to most beta-lactamases. It is inactivated by renal dihydropeptidases in renal tubules. That's why binibigay siya with cilastatin. No? So, si meropenem and ertapenem, kahit wala silang cilastatin because they are resistant to dihydropeptidases. So, ito yung parang sacrificial drug na sila. Yeah. So, same lang naman din yan, si ertapenem. So, other cell wall membrane active agents, we have vancomycin. So, vancomycin is produced from Streptococcus orientalis. So, it is active only against gram-positive, no? Gram-positive. So, this is the drug of the mechanism of action. It inhibits cell wall synthesis by binding firmly to the D-alad terminus of the nascent peptidoglycan peptide. It is indicated for sepsis or endocarditis caused by methicillin-resistant F staphylococci. So, usually, pag MRSA na yung if initially, pwede pa kami magbigay ng clindamycin. Pero, if resistant to clindamycin plus MRSA, ideally, vancomycin na talaga. No? Orally, it can be given to antibiotic-associated enterocolitis caused by Clostridium difficile. It is also famous to this adverse effect. Redman or redneck syndrome. It is an infusion-related flushing. So, nangyayari, nagkakaroon ng release of histamine. That's why nagkakaroon ng redneck yung patient. So, ito patient, nakakita na ako ng ganito, no? On patient na binigyan namin ng vancomycin. So, dito, ang ginagawa lang is, pinatatagal lang yung infusion. Hindi mo pwede siyang ibigay na for 1 hour. So usually 1 to 2 hours or mas matagal na kaya i-infuse yung vancomycin. But it doesn't necessarily mean na kailangan siya i-stop. Okay? Teicoplanin is glycopeptide antibiotic that's very similar to vancomycin in antibacterial spectrum. Daptomycin, it is from Streptococcus roseosporus. It is similar to vancomycin except that it is more rapidly bactericidal in vitro. It is active against vancomycin intermediate and resistant strains of Staphylococcus aureus. So after vancomycin, if it's resistant to vancomycin, no, we can give daptomycin. Pero wala pa naman akong sa level na ganito nung may patient akong naging resistant sa vancomycin. Phosphomycin prometamol, so it is ang mechanism of action is it inhibits enzyme pyruvate transferase by covalently binding to the cysteine residue of the acid site. Itong phosphomycin, ginagamit siya, familiar kayo sa mga binibigay sa UTI sa centers. Phosphomycin, nabigyan na kayo before, sino man kakilala nyo. Pinapainom yan, tapos sasabihin sa patients na sa morning, ipipigil muna yung igil. No? So, kasi yung ang ano nito is yung active ingredient or metabolite is excreted sa ihi. So, ang mangyayari, ipipigilin na yung ihi, then after doon, tsaka, thank you. Tsaka, iihi, no? Siguro for an hour yan. So, yung patient, i-take yun for 3 days, parang gano'n. Then, okay. Yan, for uncomplicated lower UTI, no? Pag complicated, syempre, hindi na pwede. Kunyari, nagkalag ng patient, sumasakit ang balak ng patient, no? Baka it warrants admission. Oral. Iinumin siya ng patient, tapos, pag may ihina yung patient, pipigilin niya yung pag-iinom niya. Yan. Bacitracin, so it is a cyclic peptide mixture from Bacillus subtilis. It is active against gram-positive. So kung mapapansin nyo, yung mga antibiotics natin are derived also from the backbone of a bacteria also. So it inhibits cell wall formation by interfering with the phosphorylation by cycling of the lipid carrier that transfers peptidoglycan subunits of the growing cell wall. So para basta pag makikita niyo itong mga drugs na to, pag cell wall synthesis, para parehas ang goal nila isiraan yung cell wall ng bacteria. No? So it is usually added to polymyxin and neomycin for wounds, irrigation of wounds, joints, and pleural cavity. So, currently, kasi highly nephrotoxic siya, kaya topically na siya. Alam ko available pa rin itong bacitracin insan sa mga pang-wound care. Cycloserine, it is an antibiotic produced by Streptomyces orchidaceus. So, mapapansin nyo, same lang din yung mechanism of action. And cycloserine is also included as second-line drug, no, for tuberculosis. No? Di ba may first line tayo? Yung first line natin, sige mamaya na lang. Second line, sabi anti-TB din tayong lecture, no? Yeah. So, lagi niyo tatandaan that cell wall synthesis inhibitors are generally bactericidal. So, ang goal nito is to kill the bacteria. So, for the next lecture, PowerPoint we have aminoglycosides. So aminoglycosides are widely used against gram-negative, no? So kung makikita niyo yung penicillin, beta-lactamase drugs, meron silang spectrum, meron pang gram-positive, may pang gram-negative. Etong aminoglycosides are exclusive to gram-negative bacteria. So streptomycin na guys. ST, streptomycin, neomycin, and the others. So ang backbone naman nito, it has hexose ring. No? Yan. Yung hexo, so mayroong 6 corner ng shape. Backbone. Or the hexo. So pare-parehas yan. So ang mechanism of action nito is it binds to the 30S subunit ribosomal protein. Pero exception is streptomycin because it binds to S12, S12, no? S12 subunit. But generally, they bind to 30S. So, mangyayari dyan kasi, pag nag-bind siya doon, nag-bind kasi doon, no? Binablock niya yung initiation ng protein synthesis. So, nangyayari, nagkakaroon na premature termination of coding itong mga DNA subunits, no? Therefore, mamamali na siya, no? Mag-i-incorporate ng incorrect amino acid, therefore, mamamatay yung bacteria. Kaya siya protein synthesis inhibitors. So, general properties, it is concentration-dependent killing, and however, it has a significant post-antibiotic effect. No? They are known for adverse effects like ototoxicity and vestibulotoxicity. So, ototoxicity means it damages the hearing no, ng patient. So, we have auditory damage and vestibular damage. Sinabi namang vestibular damage, it damages the balance of the patient. No? So, auditory, tinnitus, merong hearing loss. Actually, meron akong patient na naging ganyan before. No? Surgery department before, they prescribed with, they gave the patient with amikacin. No? Tapos on day 8 of the patient, nagko-complain na yung patient ng hearing problems. No? Nabibingi yung patient. So, nirefer sa internal medicine at that time. Wala na kami magawa but to discontinue the patient kasi discontinue the antibiotic kasi nabibingi na yung patient, no? And sometimes it can be irreversible. So, hoping na mare-reverse, so discontinue namin yung drug, then we suggested other antibiotics for the patient. No? And also vestibular damage, no? Yung parang pagka nahihilo yung patient, gano'n, or parang kunyari nagkakaroon sila ng vertigo. Familiar kayo sa vertigo? So, nagkakaroon ng rotatory motion yung patient while hindi ba siya gumagalaw. No? And ito, paki-take note kasi ito talagang sobrang important, no? The adverse effects, no? Ito yung mga most ototoxic na mga aminoglycosides, neomycin, kanamycin, and amikacin. And the most vestibulotoxic, streptomycin and gentamicin. So, pakitandaan yan. Lagyan nyo na malaking star. Also, adverse effects ng is they are known to be nephrotoxic also. So, may mga pagka ibibigay yung yung mga gamot na to, it needs renal adjustment. So, the most nephrotoxics are the following: neomycin, tobramycin, and gentamicin. And concurrent use of loop diuretics and other nephrotoxic antimicrobial agents are avoided during as much as possible. No? For example, vancomycin, nephrotoxic din kasi yan. No? Amphotericin B, nephrotoxic din yan. So relatively, it can damage the kidneys of the patient. So sometimes it can cause curare-like effect with neuromuscular blockade that can result to respiratory paralysis. So, yan naman ay kung nabigay ang high doses. So, they are widely used for gram-negative enteric bacteria, no? That is causing bacteremia and sepsis, endocarditis, and also they are used as second-line drugs for tuberculosis. So, streptomycin is from a strain of Streptomyces griseus, no? Second line treatment yan, kaya may tinatawag tayong RIPES, di ba? Pag yung patient nasa category 2 na ng TB treatment, na hindi pa rin sila gumagaling sa conventional na TB treatment, minsan inadagdagan yan ng injectable na streptomycin. As in daily yun na treat na injection for 6 to 12 months. No? Enterococcal infections, and ito din ginagamit for plague, tularemia, and brucellosis. Pero kasi ito sa mga other countries yan. Gentamicin, it is isolated from Micromonospora purpurea for gram-positive and gram-negative bacteria added to vancomycin and penicillin for endocarditis. So usually, gentamicin, amikacin, and other drugs IV, no, combine yan with other other drugs, no, like for example, penicillins, to minsan kasi mga severe infection and highly resistant na yung mga drugs. So minsan kino-combine yan with cell wall synthesis inhibitors para masira yung cell wall ng cell wall ng bacteria, at the same time sisirain yung protein synthesis ng bacteria. So talagang tepok talaga yung bacteria, no? So also binibigay yan for patients with infected burns, wounds, skin lesion, and ocular infection. And also for the prevention of IV catheter infection, especially dun sa mga dialysis patient, no, na naka-IG catheter. Usually, binibigyan yan sila ng gentamicin para gentamicin lock ang tawag nila dyan. Para yun muna yung i-infuse before normal dialysis, no? Alam niyo na mga nagda-dialysis, sayang wala. Pero okay lang na naman wala kayong mga relative na nagda-dialysis. Pero yun nga, in case lang, ano, at least sharing ba of sharing, no? Alam niyo lang na, oo, nakikita ko yan, binibigay dun sa kamag-anak ko na ganyan, di ba? Kasi for sure, tinatanong yung mga relatives nyo, alam kayo pharmacy student, tatanungin kayo, ay, ganito yung gamot ko, ganito, may mga ganito gamot, ganyan. Alam, para sa ano ba yan? I-revalid na kayo ng mga kamag-anak nyo, di ba? Nung pharmacy student ako, sabi, shit, hindi ko alam, malay mo ba? Tapos, papakitaan ka ng mga resetang hindi ka maintindihan yung sulat. Di ba pharmacist ka, di mo basa, ikaw makakabasa niyan. Di ba tinuturo ko kayo magbasulat ng mga siraulo? Ang sabi naman din naman sa pharmacy law, di ba, pag talagang impossible prescription, pwede mong i-insert. Pabalikin mo sa doktor. Pero grabe ako naman, I am trying my best talaga na magsulat talaga ng maayos. Kaya ako sobrang offended ako pag sinasabing hindi maintindihan yung sulat ko. Talaga pa? Ay nako. Naalala ko na naman, sabi ko, ako pa talaga hindi nyo naiintindihan yung sulat. Yung iba kasi, kaya lang naman nagiging pangit kasi nagmamadali. Yun lang naman yun. Kaya ako siya naiintindihan because I am one of them na nagmamadali. Okay? So much for that, no? So, tobramycin. Ito, familiar kayo dito, no? Sa mga nagka-sore eyes na, no? Tobramycin. Nagasas ang mata, ganyan, di ba? Usually, ointment pa yan. Di ba? So, it is same activity with gentamicin with few exception, no? It is more active against sriracha, yung gentamicin, but tobramycin is active against pseudomonas. No? So, tobramycin is also used for lower respiratory tract infections. Pero click ngayon, hindi na yan, no? Kasi because of complications, possible complications. Amikacin, so it is a synthetic derivative of kanamycin, no? So, amikacin is from kanamycin. Tandaan dito na, no? And it is resistant to many enzymes that inactivate gentamicin and tobramycin. Also, it can be used as a drug for TB, secondary yan. Netilmycin, it is active against gentamicin resistant and tobramycin resistant bacteria. Neomycin, ito ginagamit pa rin ito no, for preparation of elective bowel surgery with erythromycin base and suppression of facultative flora of the gut in patients with hepatic encephalopathy. Paromomycin, ito binibigay ito not for as an antibiotic but for intestinal amebiasis. Spectinomycin, it is an aminocyclical antibiotic that is related to the structure of aminoglycoside. However, it lacks amino sugars and glycosidic bonds. So, makikita niyo para siyang tiyapas ng as compared to sa base structure ng aminoglycoside with hexose rings, no? Meron siyang amino sugars, meron siyang glycosidic bonds, ito wala. It is an alternative treatment, no, for drug-resistant gonorrhea and for patients with gonorrhea in penicillin allergic patients. So, the activity is that protein, so in general, protein synthesis inhibitors are bacteriostatic with the exception of aminoglycosides and streptogramins, no? So next, quinolones. Folic synthesis antagonist. So, nakabase yan sa folic, no? Sa bacterial de novo biosynthesis of folic from PAPA or the p-aminobenzoic acid. So, ito, p-aminobenzoic acid is converted to pure to tetrahydrofolic acid. Tetrahydrofolic acid then forming the DNA. No? Ang goal natin is to prevent them from forming the precursors. No? Therefore, wala na magpo-form ng DNA of the bacteria. So what? Pakitandaan nito mga enzyme na to. We have dihydropteroid synthase and then dihydrofolic reductase. So dihydropteroid synthase is inhibited by sulfonamides, while dihydrofolic reductase inhibited by imidacloprid. So sulfonamides are structural analog of the PAPA. You know? The spectrum of activity is that it targets gram-negative and gram-positive bacteria, some protozoa, however ineffective against Rickettsia, anaerobes, and Pseudomonas. So there are drugs, it is usually combined with other agents, no? Such as cotrimoxazole, no, or sulfamethoxazole and trimethoprim, commercially known as Bactrim. It is the drug of choice for pneumocystis jirovecii pneumonia. Ito yung mga pneumonia found in patients with yung mga HIV/AIDS, no? Toxoplasmosis and nocardosis. Before nagkaroon ako ng patient na gano'n, sobrang disheartening talaga yung kwento niya. Hindi ko talaga siya makakalimutan talaga, no? Nag-start lang siya as appendicitis, nagpa-opera siya. Then after 1 month, hindi gumagaling yung sugar niya. Nagdadana yung mood. So, dinala sa hospital kung saan ako nag-duty. When I was a resident, first year ako doon. Then, suddenly, meron siyang TB. Then, nagkaroon na siya ng pneumonia. Kasi syempre, nung una hindi siya umaamin na meron siyang sexual activity. Then, yun nga, no, medyo pumupangan yung lagay niya, hinamin niya na rin na meron siyang male-to-male encounter with the unprotected. No? Noong time na yun na nagre-review center siya sa for his preparation for LEP, yung teacher's board exam. Tapos yun, ang nangyari, yun na positive siya. Ang bili niya sa akin, wag kong sasabihin kahit anong mangyari. So ang hirap-hirap nung kasi hindi ko talaga maano sa mga relatives kung paano ba magtatanong kasi ayaw niya talaga ipa-disclose. So yun. So ang nangyayari, so that time talagang so hanggang sa namatay yung patient. So namatay siya due to pneumonia. So yun, yung characteristic, meron silang characteristic na pneumonia caused by pneumocystis jirovecii because of immunocompromised state. And usually, at the time na yung patient na diagnosed natin with HIV, binibigyan natin sila ng prophylaxis na cotrimoxazole. Next, we have Fansidar, no? Yung sulfadoxine and pyrimethamine. It is used for malaria. No? And it is also available as oral non-absorbable agents such as sulfasalazine, no? For IBD, in irritable bowel disease and enteritis. For topical, we give mapinine and silver sulfadiazine for wound. Usually yung mga sino na ba dito ang napasok ng ano, na motor, ganyan, or something na pasok na dinala kayo sa ano. So baka possible na bigyan kayo ng silver sulfatalic. So silver sulfadiazine, gold cream siya na binibigay, no, as antibiotic doon sa wound. Pyrimidines, so yun nga, no, it acts on the dihydrofolate reductase. It combined with sulfonamide to block yun nga yung mga enzyme, no, that can lead to the formation of the DNA. So there are examples yung trimethoprim and pyrimethamine. Next, we have DNA gyrase inhibitors known as quinolones. So quinolones are fluorinated analogs of nalidixic acid. They are active against gram-negative and gram-positive bacteria. So the mechanism of action is that it inhibits, pakitandaan, no? Bacterial topoisomerase 2 and topoisomerase 4. Okay, dalawa. So this drug blocks the DNA by inhibiting topoisomerase 2 and topoisomerase 4. Topoisomerase 2 prevents relaxation of positively supercoiled DNA. So, ang gagawin niya, piniprevent niya na mag-relax. So, ibig sabihin, ipip-empty niya na naka-supercoil. No? Kasi ang DNA naka-supercoil yan, di ba? So, ang gagawin niya, ipip-prevent niya yung supercoiling. So, inhibition of topoisomerase 4 naman, it interferes with the separation of the replicated chromosomal DNA into their respective daughter cell. So, that thus it prevents yung DNA propagation niya. And there are 4 generations as gaya ng cephalosporin, no? But in this class, may lumonti sila. So, pakitandaan na, syempre, no, pakakonti na yan. So, the prototype na lidixic acid, it is used only for lower tract, urinary tract infection. Pero currently, hindi na ako nakakakita ng ganitong drugs. So, the second and to fourth generation are fluorinated. Sabihin, they have fluorine in it. Norfloxacin is the least active among fluoroquinolones, no? Third generation, we have levofloxacin and ciprofloxacin. Ciprofloxacin is the drug of choice for prophylaxis and treatment of anthrax. And levofloxacin is an L-isomer or L-isomer of ofloxacin with superior activity for gram-positive organisms. Fourth generation, we have respiratory quinolones, no? Genifloxacin, moxifloxacin, and ganifloxacin. No? They have improved activity for gram-positive, Streptococcus pneumoniae and Staphylococcus bacteria, but with less activity against gram-negative, that's ciprofloxacin. For the tetracyclines, so this is the basic structure of the tetracycline backbone. No? So makikita nyo, they have combined na hexostrings. No? So tetracycline is a broad-spectrum antibiotic with coverage from gram-positive to gram-negative bacteria. The mechanism is also, it targets 30S subunit of the bacterial ribosome. So it is with the same mechanism as aminoglycoside. So tetracyclines, absorption is impaired with food, divalent cations, dairy products, and alkaline pH. That's why, pag binigyan ng tetracycline, we advise our patients na inumin siya parang 1 hour before meals, parang 1 to 2 hours before meals, or 4 hours after meals. Kasi yun nga, ma-alter yung absorption ng gamot. Especially kung dairy products. So it has this classification. We have the short-acting, intermediate-acting, and long-acting tetracyclines. So ito pwede nyo rin i-familiarize. No? Tetracyclines are the drug of choice for infections with Mycobacterium pneumoniae, Chlamydia, Rickettsia, and other spirochetes. So it is usually combined. Ito na nga, sasagutin na nga natin. So combination therapy for ulcer, disease caused by H. pylori, plague, tularemia, and brucellosis. So, yun nga, no? Sige, mamaya na lang. So, other uses includes acne, no? So, may mga acne dyan na sobrang lala. Dati nun talaga, uminom din naman ng ganyan, doxycycline for 8 months, 8 weeks, imagine, 8 weeks, no? Para sa acne. Bronchitis, pneumonia, Lyme disease, relapsing fever, leptospirosis, and non-tuberculous microbacterial infections. So, yun yung mga uses na. However, yun nga, may mga GI effects yan, both liver toxicity and moving structures and heat. It can cause discoloration and bone deformity, especially on children, no? Kaya hindi siya ina-advise na pwedeng ibigay sa mga children lower than 8 years old. Kasi pwedeng niyang i-discolor yung teeth at saka maging weak yung bone fracture. Maging prone to bone fracture yung mga bata. At saka sa pregnant, bawal din siya. It has also kidney toxicity. It can cause renal tubular acidosis. Some are photosensitive and some can cause vestibular reactions. So doxycycline is the drug of choice for primary stage of Lyme disease. It is a first-line agent for prophylaxis of anthrax after stroke. It is the oral tetracycline of choice and the preferred parenteral tetracycline. Ito rin yung binibigay natin for prophylaxis sa mga leptospirosis. No? Sino mga nakatira dito sa mga ilog, coastal area na unsafe, no? Kasi dati nun meron akong patient, nagkakaroon siya ng parang nagre-renal failure siya, so hindi ko alam kung hindi kagaling. Tapos, sabi niya, sabi ng team ko, nagpapaha po ba sa inyo? Ay, opo, lumusok pa sa paha. Ay, hindi po. Nakabota po ako, pero may sugat pala siya sa kamay. Tapos, ginanon niya yung tubig. So, leptospirosis pala. So, dapat malinaw, no? Pag leptospirosis, dapat hindi lang sila lulusog. Bawal lumusog sa tubig at bawal lumutaw daw ng tubig, no? Ayun. So, kala namin, initial diagnosis sa ER, dengue. So, minamanage ko siya as dengue. Pero, nung parang hindi nag-i-improve. Yung pala, sabi nung kanina po nagdudura ng function ng dugo. Tapos pagtingin ko at ang creatinine, yung pala, leptospirosis na pala. So, important yan, doxycycline. Ginagamit din siya for doxycycline sa mga prevention sa mga, yung mga pag ganyan, pupunta ka na Palawan, ganyan. So, yun, prevention, prophylaxis. Ito, doxycycline very good. Yung sa may mga malaria-prone areas. Doxycycline, dimeclocycline, and tigecycline. So, they are also used within medications, pero mga naisinunan na lang yan. Macrolides, so they are characterized with a macrocytic, microcyclic lactone ring to which deoxy sugars are attached. So, yung mga deoxy sugars, ito yun. So, mamaya sasabihin natin. Erythromycin, it is the protozoic drug. No? It is, di ba, from ano siya? From ilisoil, di ba? And the other types like erythromycin and azithromycins are semi-synthetic derivatives of this drug. It is obtained from Streptomyces erythritidis. It is used for the drug. It is a drug of choice for corynebacterial infection, as well as respiratory, neonatal, ocular, genital, chlamydial infection. It is given to patients with penicillin allergy. No? So, kunyari patients ang penicillin, allergic po ko sa penicillin. Sabi ko ng doktor ko dati. So, pwede namin bigyan ng erythromycin as an alternative. No? At saka sa mga newborn babies, no, binibigyan ng erythromycin eye ointment yan pagkapanganak. To prevent yung mga ocular infection during birth. No? However, yun nga, patients complain of GI intolerance. Masakit sa sikmura raw yan. No? And sometimes, yun nga, yung erythromycin escalate can cause hepatitis. Also, erythromycin is also an enzyme inhibitor. No? Kasama siya sa mga enzyme inhibitors. Clarithromycin. So, erythromycin plus a methyl group is clarithromycin. No? And it has several advantages like yung improved acid stability in oral absorption, less GI intolerance, and less frequent abuse. Ang clarithromycin can be given parang twice a day, pero yung erythromycin parang 6 every 2-6 to 3 weeks. So, mas mahirap. Azithromycin, so kung kanina naman methyl group, ang azithromycin is erythromycin plus methylated nitrogen, no? Sa lactone. Yun naman ang difference niya. It has similar activity with clarithromycin. Kaya siya 3 days lang, di ba? Pag nakakita na ba kayo ng Citromax, di ba nakabalot siya by 3 lang siya. Kasi 3 days lang yung slowly release siya from tissues. Kaya ano nangyayari, yung elimination half-life niya mahaba. That's why 3 days lang siya. Pero sa pneumonia, we prefer, kasi ganyan, nagde-developing naman ang science, no? Sa guidelines, we can give it sa pneumonia na 5 days. Kaya minsan magbubulan kayo, 5, bakit kaya 5%? Ano ba? So yun, dahil yun doon. Pero usually 3 days lang talaga. Ketolides, they are semi-synthetic 14 membrane ring macrolide. Example is telithromycin, used for the following indications. It is a reversible inhibitor also. Pero hindi pa ako nakakakita nito. Lincomycins, like clindamycin. So clindamycin is a chloride substituted derivative of lincomycin. It is active against streptococci, staphylococci, pneumococci, and Bacteroides and other animals like gram-positive and gram-negative. It targets 50S. So, kanina, si tetracycline at saka si aminoglycoside targets 30S. Ito naman, it targets 50S. No? Ribosomal protein. So, the indication is for anaerobic infection, prophylaxis of endocarditis with valvular heart disease, and clindamycin is usually combined with aminoglycoside or cephalosporin for penetrating wounds, infection originating in the female genital tract, and aspiration pneumonia. Combined also with primaquine for pneumocystic gyrovecin pneumonia in AIDS, and pyrimethamine for toxoplasmosis. However, patients are prone to diarrhea, nausea, and skin rashes. Si chloramphenicol naman, no? It is available as, yun nga, yung chloramphenicol, palmitate, and succinate. Active against aerobic and anaerobic gram-positive and gram-negative organism, also for rickettsia. However, it is rarely used na ngayon, no? Due to several adverse effects. Kung naalala nyo kahapon, it can cause gray baby syndrome, no? In children. Eh, dati pinipigay ko sa children. So, yun. So, ito yung mga ginagamit in further. Pero available pa rin siya as of today. Ginagamit pa rin siya ng mga yung mga old practitioners. Pero yung currently, ginagamit siya as sa mga eye infection, no? Highly effective pa rin siya sa mga eye infections. Kasi yun nga, no? Chloramphenicol can cause bone marrow disturbances, no? Can cause blood dyscrasias, toxicity for newborn infants like gray baby syndrome. So, lagi nyo tatandaan chloramphenicol equals gray baby syndrome na sa board exam. The streptogramins, we have quinupristin and dalfopristin. It is a combination of two streptogramin, no? It is active against gram-positive cocci, including these strains, no? Gaya ng macrolides, it targets 50S. So it is indicated for staphylococci, especially vancomycin-resistant strains of E. tissue. So it is an enzyme inhibitor and it can cause arthralgia, myalgia syndrome. So linezolid, it is active against gram-positive, including these antibiotics. It is active against M. tuberculosis. Therefore, it is also a second-line feeding treatment. So ito, unlike other drugs, no, it has a unique binding site. It is located at the 23S, no, of the 50S. So 50S pa rin siya, pero may particular siyang binding site, the 23S. So usually, linezolid is given to patients with vancomycin resistance, no? Nosocomial pneumonia, skin infections na complicated, and multi-drug resistance. Actually, nakakita ko ng patient na binigyan nito. It is in the form of IV, no? Dati, yung patient ko nun is resistant na sa vancomycin. Pero nakakita sa private hospital, sa public hospital, wala. So nakakita ko na, na siya, parang nasa pouch siya na clear. Tapos, ini-infuse siya for 1 hour. Linezolid. However, it can cause blood dysplasia, no? It can cause thrombocytopenia, or it can lower platelet, no? Or lymphopenia. It can lower the white blood cell. So, yan, natandaan nyo si Palchem, no? Ito yung ginagamit ko ng student ako, kaya yan. PA 30S, LCM 50S. Tapos yung bacteriostatic, the rest, bactericidal si aminoglycosides and stachylococcus. All, di ba sabi kanina, all protein synthesis inhibitors are bacteriostatic except aminoglycoside and stachylococcus. Okay? For the antimicrobacterial drugs, so tuberculosis is a bacterial infection caused by bacterium called Mycobacterium tuberculosis. It spreads by inhaling tiny droplets from the coughs and sneezes of the infected person. It mainly affects the lungs, pero it can include other parts of the body like tummy, glands, bones, and nervous system. Actually, kahit saan, pwede ka na magkatipid. Dati nga, ngayon nga lang kasi, pag umuubo, ang sabi, ay, TB yan, ganyan, ganyan. Ngayon kasi COVID na, pero pwede COVID plus TB rin naman. Oo. Combo. So, anti-TB drugs, meron tayong first line at second line. Yung first line, yun yung binibigay natin upon diagnosis. It is used together in initial treatment and seen to have high efficacy but low toxicity. Second line, for resistance, retreatment, and intolerance to first-line drugs. They have low efficiency. They have low efficiency but high toxicity. So makikita nyo naman, no, talaga naman high toxicity second line. No? Kaya yun ang mga nasabi natin, tetrotoxic, ototoxic, vestibulotoxic, no? Lahat ng toxicity nasa kapila. Ito, isoniazid, rifampicin, ketamine, and are considered as the first line. No? But I have, ito, gusto ko lang i-highlight itong mga definition, no, ng TB, ng mga TB, ng mga tuberculosis. We have drug-resistant tuberculosis. So it is the resistance of TB bacilli to one or more anti-TB drug. So, ibig sabihin, basta may resistance siya sa kahit ano, drug-resistant tuberculosis. The first line. At sa kahit anong TB treatment. But, meron siyang subtypes. So, sinabing mono-resistant TB, ibig sabihin niyan, resistant siya sa first line anti-TB. So, ibig sabihin, kunyari, resistant siya sa rifampicin. Category siya as mono-resistant TB. Hindi naman ako yung film. Ang laki ng chat. Second, we have polydrug-resistant TB. Ibig sabihin naman, resistance to more than one first-line TB treatment other than the isoniazid and rifampicin. So, for example, resistance siya sa rifampicin. Ano siya? No. Pero pag resistant siya sa pyrazinamide, polydrug resistant. Kasi diba, other than, no? Other than both isoniazid and rifampicin. So, yun yung qualifier doon. So, it pertains to yung pyrazinamide and ethambutol resistance. Multi-drug resistant, it pertains to resistance to at least isoniazid and rifampicin. So, sino pa may relative dito na TB treatment or gene expert nagpa-test ng dura? Meron ba? Kasi yung gene expert, testing yun para i-test kung pagdura niya, makita kung rifampicin, ano siya, rifampicin resistant. So, ang mangyayari doon, pag nag-positive yun sa result, nakalagay doon, RIP resistance. Makared yan. Ibig sabihin doon, resistant na siya sa isoniazid and rifampicin. No? Therefore, hindi siya pwedeng bigyan ng conventional treatment. diretso na siya na treatment for secondary, second line. Okay? Pag extensively resistant TB na, ang tawag naman din ay XDR-TB. Pag multi-drug resistant TB plus resistance to any fluoroquinolones, no? So, multi-MDR-TB plus may resistance ka pa sa at least one of the 3 second-line injectables like cliomycin, kanamycin, and amikacin. Yan, XDR-TB. Dapat ito naka-isolate na ito. Kasi it can nakakahawa to. Highly contagious yung mga ganitong patients. Pag rifampicin resistant TB naman, RR-TB, resistance to rifampicin lang. No? So, yan, no? So, minamanage yung mga DRTB for 18 months na using the second line drugs. At yan, nire-refer yan sa mga satellite treatment center. For TB treatment, dapat isolated yung mga yan. So, first line agents, we have isoniazid, also known as isonicotinonic hydrazide, kaya siya INH. No? It is the most active drug for TB. It is bactericidal. So, ito important din pala dito, no, sa board exam, especially, no, na pakitandaan, no, yung ating drug of, yung mga mechanism of actions din ng mga, kahit ito lang 4 na to, no, kasama yan sa tatandaan din. Yung mechanism of action ng mga drugs ng TB. Kasi majority, maraming Pilipino may TB, kaya hindi malayo magtatanong ng TB sa board exam. So, isoniazid can be used as a single agent as prophylaxis. So, kunyari, di ba, nagkaroon ng TB sa isang household, hindi lang isa yung may TB ang gagamutin. Lahat ng kasama sa bahay, gagamutin yan. No? And pagka may TB sila, yung ibang kasama sa bahay, makaka-receive din sila ng TB treatment. Pero, yung kunyari, wala namang TB sa X-ray, negative sa screening, they will also take prophylaxis. So, yun ang binibigay isoniazid, no? 1 tablet every morning din for 6 months. And it is considered, isoniazid is considered safest in pregnancy. So, it is metabolized by acetylation by the liver, and acetyltransferase, no? However, other effects, no, most frequent is INH-induced hepatitis. So, due to the formation of N-acetylhydrazine, peripheral neuropathy, nasabi natin yung kahapon, kakaroon ng pyridoxine deficiency, that's why we give vitamin B6 or vitamin B complex to patients. CNS toxicity, memory loss, psychosis, and seizures. Rifampicin from Streptomyces mediterraneae. It is a synthetic, a derivative of rifamycin. It is also bactericidal. It is an it can be given as an alternative to INH for prophylaxis. Should not be administered for the first trimester of pregnancy. No? So, ang mechanism of action nito is the inhibition of bacterial DNA-dependent RNA polymerase, no? To prevent or to inhibit RNA synthesis of this TB molecule, bacteria. Ang adverse effect nito is it is known for the harmless orange to orange-red urine, no? So, pag umihi ito sila, pag orange ang ihi, ayan, rifampicin yan, nagre-rifampicin. Less common can cause thrombocytopenia, jaundice, and hepatitis. Ethambutol, so unlike the first two, no, it is bacteriostatic, no? It is relatively safe for pregnant women. Ang mechanism of action nito is that it inhibits arabinogalactan portion of the cell wall, inhibiting arabinosyl transferase. Most common adverse effect nito is retrobulbar neuritis, it can cause loss of visual acuity. Or ibig sabihin, it can cause color blindness, no? Kaya important yung mga patients, ini-screen muna ng baseline vision before taking anti-TB drugs, especially ethambutol. So it is contraindicated for patients na very young and patients with renal failure. Pyrazinamide, it is a nicotinamide analog and used in combination with other drugs. It is the mechanism of action is pH dependent, no? Since it is bactericidal at acidic pH and inactive at pH 7. It is converted into its active form, pyrazinoic acid, by the mycobacterial enzyme pyrazinamidase. And this active form lowers the intracellular pH to its suboptimal level to inactivate the target enzyme that is responsible for the metabolism of the mycobacterial bacteria. So, important dito that maalala nyo na pyrazinamide is the most hepatotoxic among them, no? Followed by rifampicin and isoniazid. So, yun yung hierarchy, no? It can cause hyperuricemia, fever, nausea, and vomiting. Kaya, after 1 month of treatment, nagpaparepeat ng labs, pinapacheck din yung uric acid ng pasyente. Kasi baka tumataas yan. Minsan, may mga patient tayo, sumasakit ng joints, ganyan-ganyan. So, bibigyan namin ng allopurinol na lang for hyperuricemia. Ito, pakitandaan lang din, no, na there are different categories for the recommendation of the duration of therapy for patients with pulmonary tuberculosis and extrapulmonary tuberculosis. Pag sinabing extrapulmonary, outside the lungs. So, yung kumapasok yung bones, CNS, kung saan mga yung TB niya, no? So, for category 1, ito yung mga newly diagnosed na pulmonary TB, miliary TB. Pag sinabing miliary TB, as in talagang kalat-kalat yung TB all over the lungs. No? And new EPTB is extrapulmonary TB, except if it's in the CNS, bones, or joints. So, bibigyan niya ng 2 months of HRCE and 4 months of HR. Pag category 1A, yun yung mga CNS, TB bones, TB of the bones and joints. Relatively, di ba, as I've said before, no, na treatment sa mga bones, no, they have, dahil nga less ang mga blood vessels, no, entering the bone, mas mahirap ang penetration ng drugs, relatively, mas matagal ang treatment. So, we give it 12 months siya. So, 2 months of HRCE and 10 months of HR. Pag category 2, it means retreatment of susceptible PTB and EPTB. Sabihin, retreatment, pwede siya ng fail, tumigil siya, failure to follow up, pag re-restart ulit, nagkaroon ulit ng hingal, ganyan. Maraming ganyan, no? Tumigil after 3 months kasi gumanda na yung pakaramdam nila, so tigil na sila. Tapos after ilang months, inuubo na naman, no? So, yun, malaking problema yan. So, we give another regimen na naman, no? So, as you can see, 2 HRZES. S is streptomycin. So, may injectable na siya for 2 months. Then, 1 month of HRZE, then 5 months of HRT. Or, so, yun yung regimen. Category 2 naman, it's the treatment of the bones and joints. So, 2 months of HRCS, 1 month of HRT, and 9 months of HRT. 1 month of HRCE and 9 months of HRT. So, that is the regimen for TB treatment. For the second line agents, so streptomycin, so nasabi na natin yan, no, that It is an aminoglycoside. It is a bacteriostatic agent. Yan. Ototoxic and nephrotoxic siya. Ethionamide, it is clinically similar to INH. No, the mechanism is same with INH also. These are the following adverse effects. Capreomycin, it is an aminoglycoside, no, which is nephrotoxic and ototoxic as well. Cycloserine, it can cause peripheral neuropathy and sinus dysfunction. PABA, p-aminosalicylic acid is also given, no, to inhibit folate synthesis. However, it can cause peptic ulceration, GI symptoms, and hypersensitivity reaction. Amikacin and kanamycin, they are also second-line treatment. So, sabi naman, there's no cross-resistance between streptomycin and amikacin. So, if capreomycin, however, if the organism is kanamycin and capreomycin resistant na rin siya sa amikacin. Okay? But, different yung usapan pag streptomycin. Ciprofloxacin and ofloxacin are also given, no? That's why, pag magbibigay kami ng ciprofloxacin, yung mga fluoroquinolones, we have to make sure na walang TB. Kasi, or wala pa siyang, kasi pwede siya maging resistant, no? Kasi pag may history ka nga ng treatment nga ng, pwede kasing, na-perceive na siya ng katawan ng bacteria. So, magko-conform na siya, mag-evolve na yung bacteria into something na pwedeng hindi na siya tatablan ng ganang antibiotic. And rifabutin. So, rifabutin is also similar to rifampicin. Clofazimine, it is more used as for patients with leprosy, no? It is the last resort. So, nakakita na kayo may ketong. Diba? So, mga anti-leprotic agents. So, it is also known as Hansen's disease. So, Hansen's disease is an infectious disease caused by Mycobacterium leprae. It involves the skin, no? The peripheral nerves, and the mucosa of the upper respiratory tract and eyes. It is transmitted via droplets, nose, and mouth during close contact and frequent contact with untreated cases. So, makikita, no? Ang ketong, meron sila hypopigmentation, at the same time, parang pain, no? Parang meron silang problem sa peripheral nerves. And there are different classification, no? We have tuberculoid, lepromatous, and borderline. So, yung tuberculoid, it is the less severe, no? Type ng leprosy. The lepromatous is the extreme or the severe type. So, tuberculoid, it has few patches of discolored skin and with less nerve damage, no? It is less contagious. Pero pag lepromatous, it is the one that is more contagious and with many complications like muscle weakness, problems in the nose, kidneys, and reproductive organs. So for the drugs, no, Dapsone is the widely used drug for leprosy. It is bacteriostatic. It is also a folate synthesis inhibitor for macrobacteria. These are the following adverse effects. And to prevent resistance to Dapsone, rifampin is added. No? Clofazimine, it is a dye, no, that is alternative to Dapsone. Usually given for sulfone-resistant leprosy. However, the mechanism is unknown. Ang adverse effect nito is that it can cause discoloration of the skin from pink to brownish black. Since it is a dye nga, diba? And the treatment includes the three regimen with rifampicin, dapsone, and clofazimine. For paucibacillary, or we gave it for 6 months, and multibacillary, we gave it for 12 months. Okay. Okay, kaya natin yan. For antifungal agents, anong page na tayo sa 8 pa lang? O malapit na. Tapos lunch break na tayo. Okay. For antifungal agents, so fungi are eukaryotes. The cell wall is like called chitin. No? It's made of chitin pala. And the main component of the cell membrane is ergosterol. No? So, dito nagre-revolve yung mechanism of action, no, ng fungal. Kung may cell wall synthesis inhibitor din ang bacteria, meron din sa fungi. So, yun yung majority naman na ng mga antifungal drugs. So, number one, we have the cell membrane disrupting agents like choline, antibiotics such as amphotericin B and cysteine. They bind to the ergosterol and alters the permeability by forming a pore formation that allows the leakage of intracellular ions and proteins. So, as you can see, no, so this is the cell wall, no, na fungi, and amphotericin B creates a pore that leaks the electrolytes that will kill the fungi. Okay? Allylamines, for example, terbinafine, it inhibits the fungal enzyme squalene epoxidase, inhibiting the formation of ergosterol. And azoles like ketoconazole, conazole, clotrimazole, itraconazole, and fluconazole, it inhibits the fungal cytochrome P450 enzyme lanosterol 14 alpha demethylase to inhibit the conversion of lanosterol to ergosterol. So here is the diagram, no? Terbinafine is an allylamine, no? From the ano to, yung ano yun, yung chain, ano? Acetylcholine as a precursor, no? Terbinafine inhibits conversion of squalene epoxide. No? Therefore, prevent na din yung formation ng lanosterol to form ergosterol. Ganun din si itraconazole, no? Which is an azole. So it inhibits this enzyme to prevent lanosterol from forming ergosterol. Therefore, kung walang ergosterol, wala na siyang supply for formation of chitin, formation of cell membrane. Next, we have glucan synthesis inhibitors such as echinocandins. So echinocandins includes anidulafungin, caspofungin, and minofungin. Ang mechanism nito is that it irreversibly inhibits beta-1,3-D glucan synthase. So kung walang synthesis ng beta-1,3-D glucan, it reduces the cell wall integrity, therefore cell rupture, and it leads to the fungal death. So yeah. So kung walang nalipid itong beta-1,3-D glucans, so nagiging yung wall. And also, we give flucytosine. So flucytosine is an anti-metabolic type of drug that is synthesized. This is synthetic fluoridated pyrimidine related to fluorouracil. So flucytosine So it is, indeed, there's an uptake of the fungal cell of endocytes. It is converted into something else, no? So, ano nangyayari, instead na mag-form siya ng RNA, ito ang napo-form niya. Okay? So, ano nangyayari, nagkakaroon na changes in the RNA formation. So, we will also have antimitotic like Briseocolvin. In general talaga, there's no approved mechanism for Briseocolvin. However, it is postulated that inhibits fungal mitosis by inhibiting the mitotic spindle formation of fungi. So based on route and indication, classification, amphotericin B is derived from Streptomyces nodosus. Nodosus is the most effective antifungal agent for systemic fungal infections. It is a treatment of choice for the following fungal infection. However, it is poorly absorbed orally. It has a poor CSF penetration. That's why ang preferred route nito is intravascularly, intravenous pala, intravenous, intrathecal, and intrasynovial. And also, it is sensitive. That's why ano siya, naka-cover siya pag ini-infuse. So it is known to be nephrotoxic also, no? So dapat ito introduce adjusted dose when given to patients. And as a rule, hindi pwede siyang isabay with other nephrotoxic agents like aminoglycosides, no? And neoplastic agents like cystatin. Flucytosine is a water-soluble pyrimidine analog that penetrates well with CSF. And usually, it is given with amphotericin B. Since tawag dito, it is in combination. Usually kasi, since amphotericin B will form a pore for the drug to penetrate or para ma-penetrate natin yung fungal wall, no? Flucytosine will go inside. Ang target naman ng flucytosine is to go inside the cell to alter the DNA at the RNA formation, no? So kaya usually silang dalawa yung pinag-combine, amphotericin B and flucytosine. However, these are the following adverse effects. Azole, it is a fungestatic, no? And they are classified based on the differences in the number of nitrogen in the 5-membered azole ring. So the imidazoles, it composed of 2 N atoms. We have ketoconazole, miconazole, and clotrimazole. The triazoles, we have 3 N. It includes itraconazole and fluconazole. Ano yung nizoral? Nizoral is hindi, ano siya? Ano doon? Nizoral is ketoconazole. Anong brand ang clotrimazole? Alam ko letter C. Clotrimazole. Nasa ano yan, sa commercial. Hindi na siguro kayo nanonood ng TV, no? Canesten. Diba? Kasi hindi ko alam kung naabutan niyo pa si Robami. Di ba may commercial si Robami? Basta meron commercial dati si Robami na parang Canesten ata. Goodbye sa Punjay. So, azoles is specific, has a specific affinity to fungal cytochrome than human cytochrome P450. No? And ketoconazole is the first oral azole introduced. It has a low pH and would increase absorption. However, due to complications, adverse effects, no, hindi na to binibigay orally. So more on ano na siya, topical. Itraconazole is the most potent among them, no? It is effective against these drugs. So itraconazole, it is food and low pH increase absorption. It penetrates poorly in the CSF, no? And it does not affect gonadal hormone synthesis. These are the following adverse effects. Fluconazole is a drug of choice for sinus infection involving Cryptococcus and Candida. So the differentiating properties is that it is water soluble and has a better or good CSF penetration. Nystatin, it is a fungicidal and fungistatic properties. It is primarily it is used as a topical agent, no? Currently yung nystatin binibigay na lang siya as kasi 'di ba may mga ano tayo HIV patients na nagkakaroon ng mga candida ano, so yung mga swish and spit na mga gargle meron yan. And usually yung mga may vulvovaginitis, no, due to fungal infection, meron tayong mga vaginal suppository made of nystatin. Kaso po Jing, so it has a poor CNS penetration. It is an IV, no, for invasive candidiasis and invasive aspergillosis. So griseofulvin, it is a fungistatic keratophilic for systemic treatment of cutaneous fungal infections. Yeah. Terbinafine, so it is effective against dermatophytic fungi. So yeah. So based on the yung mga preparation, amphotericin B is available as cream, lotion, and IV. Nystatin is also available as topical powder, vaginal tablet, cream, no? Clotrimazole, lozenges, cream, and vaginal tablets. Also for miconazole. Ketoconazole, available siya as cream and shampoo, no? Yung Nizoral, available pa rin yan, no? And it is useful for reducing scaling due to blood clot. So yun lang important dun sa mga antifungal, antifungal drugs. Ano next yun? Sige, para bago kayo kumain, mga bulate naman. So, benzimidal, for anti-heavy drugs, no? So, for sure, nung bata kayo, napurga naman kayo. No? Sana. Hindi natin masabi. No? Lalo yung nakalimutan ng nanay nyo. No? Pero yun nga. So, usually, yun nga, yung mga yung warning is part of the parang may government's program against mga bulatin. And benzimidazoles are the most common drugs that are given to children, especially sa mga public school, no? Albendazole, mebendazole, and thiabendazole. So albendazole, the mechanism of action is that it appears to cause cytoplasmic microtubular degeneration, which in turn impairs vital processes that leads to parasitic death. So, nangyayari niyan, it inhibits the fumarate reductase specific for the generation of that helminth. No? So, it is contraindicated for children less than 2 years of age and also for pregnant patients. Also, it can cause hypersensitivity. No? Mebendazole, on the other hand, is that it binds to the nematodes tubulin. And also it inhibits fumarate reductase, no? Sorry. Ganun din si thiabenazole. Actually, pare-pares lang sila ng mechanism of action. Biotianol, it is an oral drug, no? That can be that is used as anti-hemolytic. The mechanism of action is that it couples with the parasite fumarate reductase. So mapapansin niyo pare-pares ng yung mechanism of action. So diethyl carbamazine citrate or ang ano niyan is DEC, no? DEC. It is for microfilariasis, no? Yung mga elephantiasis, no? Familiar kayo doon sa mga region 5, yung mga malapit sa mga abaka, yung mga malalaking kita, no? So yun yun, no? It immobilizes the microfilaria and alters the surface structure, displacing them from tissues, making them more susceptible to destruction. So the metabolite is diethyl carbamazine and oxide. Usually caution for patients with hypertension or renal disease. Ivermectin, the very famous, no? It is derived from the soil actinomycete, Streptomyces avermitilis. So the mechanism of action is that it causes paralysis, no, to the parasite cell membrane and muscle. Kaya ang ginagawa, kaya nga hindi ito talaga nire-recognize talaga for COVID, no? Kasi it is used for parasites na mga animals. No? And it can cause Mazotti reaction. Kaya hindi rin siya ina-advise kasi imagine no, this is a life-threatening reaction when used by humans. No? Pero kasi kala nila wonder drug ivermectin or COVID. However, it is debunked by several researches, no, that di ba binigyan pa nga siya ng compassionate use before, no? Kasi nga hindi siya allowed dito sa Philippines for human use, pang animals lang siya. MEP3-phonate, it is an organophosphate compound that is thought related to cholinesterase inhibition. Niclosamide, the mechanism of action is that it inhibits production of energy derived from anaerobic metabolism. So usually ito ginagamit for the flatworms, no? So it affects the scolex and proximal segments of the cestodes. So this is a cestode, no? So pinaparalyze niya because this part of this cestode is the sucking mechanism. Parang suction. Sa suction siya doon para pag makagalaw sila. So yan. Yan din yung mount. Oxaminitin, it is an anti-helminth that causes also paralysis at higher concentration of this drug. Paralysis on the on the specimen, on the species itself, no? It doesn't affect the muscle of the humans, no? Magkaiba. Sa ano lang sila, sa mga helmet lang sila effective. Just to clarify. So it is contraindicated with pregnancy. It can cause it can cause innocent symptoms. Kaya hindi siya binibigay for patients with history of epilepsy and for those whose work requires mental alertness. Kasi nakakahilo siya. Piperazine, so it can also cause paralysis of the helminth, no? And also praziquantel. And also praziquantel can cause tegumental damage. So for cestodes, the most commonly used drug is praziquantel. Pyrantel pamoate, no? It is a neuromuscular blocking agent that causes release of acetylcholine and inhibition of cholinesterase. Wala na pala. So, important lang na malaman nyo lang na that all of them, ang goal is to napatayin yung parasite. And also, most of them, ang target is that to paralyze the specimen or the helminth. Pero may isang question dyan na lagi daw ba kailangan, kasi may mga doctors na nagbibigay ng antihistamine. So, para daw hindi daw magwala pag uminom ng anti-helminth. May two schools of thought dyan. Ideally, dapat hindi. Kasi yung gamot mismo targets the helminth itself. So, hindi naman siya nakaka-harm ng humans. Except for the, ano tawag dito? Except for the adverse effects. No? Pero, yun nga, sabi nila, para daw hindi kasi, ang tendency kasi minsan ng ibang, ng ibang helminth is that pagka nagambala sila, they will cross-migrate. So, nangyayari, pupunta sila sa lungs, pupunta sila sa ibang parts ng katawan, kaya nagkakaroon ng ibang complication. No? Sayang hindi ko na napakita dito yung mga pero nakabula-bulati talaga na parang spaghetti. No? Pero tuturo ako ng micro yun bilang pakita. Pero yun nga, kung ano naman, pwede naman. Pero, hindi naman kailangan lagi bigyan ng antihistamine. So, it is unnecessary. Pero kung nagtitinda ka ng gamot, okay lang, sige. Bili po kayo nito. For anti-protozoal drugs, ano oras na? 12:30. Sige ba, tapos na. So, protozoal infections are common usually sa mga third world countries, no? Due to unsanitary conditions and unhygienic practices, no? Kahapon kami nakita ko yung sa South Sudan, naliligo sila sa yung ihi ng cow. Naliligo sila doon, no? Routinely, araw-araw. So, tapos iniinom din nila yung milk ng cow, tapos nahalo na lang nung cow. Kasi sinasamba nila yung cow eh. So, yun, iniinom nila as well. So, through that, pwede sila talaga magkaroon ng transmission, no? Na different. So, infection, pwede galing ba kung saan-saan. So, protozoal infectious diseases include yung mga malaria, amoebiasis, trichomoniasis, and giardiasis. For malaria, there are 4 species available, no? Falciparum, vivax, ovale, and malariae. Symptoms include high fever, shaking, chills, flu-like symptoms, and anemia. So this is the how the transmission of the of malaria, no? It originates from a mosquito bite, no? Then it will travel as a from blood, then travel to the liver, then the cycle repeats hanggang sa dumami siya sa katawan ng tao. So there are different approaches to malarial therapy. So first, ang una is for the drugs there are drugs used to treat the acute attack. So these are the ones, no? There are drugs used for chemoprophylaxis, no? And there are drugs used for radical cure, and there are drugs that acts as gametocytes to prevent by the mosquito. So usually yung acute attack, ang mechanism is that it targets the blood skin zone agent. So kumbaga, it targets the ones that are in the blood. No? So number one, we have quinine. It is available oral, IV, and IM. No, it targets the 4 species of human malaria. So it is gametocidal against E. vivax and E. ovale. It is the first line therapy for chloroquine-resistant falciparum and the first line therapy for infection of Babesia microbe. So the mechanism of action is that it inhibits the parasite's heme polymerase, allowing some accumulation of this cytotoxic substrate that can poison the parasite. So the adverse effect of this is syntonism. So sinabi na yan natin kahapon. It can cause hypoglycemia and QT prolongation. So usually it can also cause black water fever, no? Due to hemolysis and hemoglobin organ. So nasobrahan naman. Mefloquine, it is also a blood schizoticide for falciparum and vivax pseudomonas. Plasmodium pala ay plasmodium. So it has the same mechanism of action. It is highly effective for the 4 human malaria parasite. Sorry. Chloroquine pala yan, no? So chloroquine is the most highly effective against the 4 human malaria parasite. And it is the drug of choice, no? For non-falciparum and sensitive falciparum malaria. So unang-una chloroquine, then kung resistant to chloroquine, then tsaka tayo mag-iibang product. So the mechanism of action is that it accumulates in the parasite food vacuoles, releasing pH and induce raising its pH and induce rapid clumping of malaria pigment. No? It also inhibits heme polymerase. So ang nangyayari, mamamatay yung malaria species. Halofantrine is an oral drug effective for the erythrocytic stages of the human malaria species. Sulfonamides, so it inhibits the dihydropteroate synthase, no? And usually combined with other agents. So ito, nakikita na natin kanina ito, no? And usually sulfonamides are combined with pyrimethamine, no? Which is also erythrocytic and it can inhibit, so pyrimethamine naman, it inhibits the dihydropolyethylene. And known combination for malaria is Pancilar, no? So it is used for chloroquine-resistant falciparum malaria. Chlorprogranil and dapsone are also used for the treatment of the combination of pyrimethamine and sulfadiazine with clindamycin is the treatment for toxoplasmosis. Atovaquone, it is combined with proguanil to form malarone. It is highly effective for the chicken. So the mechanism on the electron transfer chain, so that it can block the nucleic and ATP synthesis in the malaria species. Artemisinin, also known as king house, artemether and artesunate are rapidly acting to all human malaria species. And it produces endoperoxide rich of the parasite food vacuole. For radical cure, isa lang yan, it is primaquine. So it targets the tissue schizoticidal agent. So lahat sila, yung nabanggit ko kanina, targets the blood. Pero kasi meron kasing phase like yun nga yung Vivax and Novale, they affect the hypnocyte, they are erythrocytic, ibig sabihin, nasa labas sila ng blood, like the organ. So meron silang, kung makikita nyo dun kanina dun sa parang flow, merong malaria na napupunta sa liver. No? So it is active against the hepatic stages. So pag nagtanong ng hepatic stages, the drug, anong pwede? Primaquine agad ang siya. Kasi lahat, erythrocytic. Okay? It is the drug of choice for eradication of dormant liver forms of Vivax and VO. It blocks the link between the erythrocytic and the erythrocytic stage, preventing the development of malarial attacks. So these are the So chemoprophylaxis, ibig sabihin ito yung mga clients natin, kunyari plan nila punta sa mga endemic ang malaria. At saka to clarify, maraming areas na may malaria, hindi na Palawan. No? So all human malaria. It is a protein is a protein and a standard chemoprophylactic drug in areas of Southeast Asia with high rates of resistance to other anti-malaria. So yan nga yan. To prevent transmission, so ito yung binibigay natin, to destroy the gametocytes. So we have Proguanil, Primaquine, and Pyrametan. For the treatment of amoebiasis, so usually we give a luminal agent and a such as yung dilosanine, idoquinol, and paramomycin. No? And sometimes we give metronidazole, no, for patients na symptomatic. So number one is metronidazole. So the mechanism of action is it reduces the nitro group pyruvate pyridoxine oxidoreductase. So it is the drug of choice for giardiasis, trichomoniasis, and for treatment of all tissue infections with E. histolytica. Sino na dito? For sure naman, baka naman, no? Meron ditong nagkaroon ng amoebiasis once in their life. Wow! Wow! Malinis siya, tubig niya talagang mineral water, no? At the first place. So yan, so mga, kung sino naman na medyo nahihiya, di ba? Binibigay doon, metronidazole, no? Naka-infuse kayo with metronidazole. So, meron siyang ibang mga para similar drugs like nitroimidazole, no, and tinidazole. However, tinidazole appears to have similar activity but better toxicity profile than metronidazole. So, metronidazole has a metallic taste. So, usually yung mga patients, pag in-infuse mo yung metronidazole, sabi nila lasang kalawang yung paglasa nila. It is common, no? And yung disulfiram-like effect. Ano ba sinabing disulfiram-like effect? Nakakakasuka, tama, di ba? Parang, yun yung disulfiram kasi ginagamit for patient na para mag-quit for alcoholism. Okay, di ba? So, caution with patients with CNS and should not be used for patients who are pregnant. Idoquinol, it is luminal agent, no? Kasi pag sinabing luminal agent, it acts on the lumen or lumen ng colon, and luminal agent. It is an effective luminal amibicide by inactivating essential parasite enzymes. Usually, binibigay ito with metronidazole. Pero dito sa Pilipinas, wala kasing iodopyridine. So, hindi natin nagagamit yan. Dilausadine furoate, it is the drug of choice for asymptomatic luminal infection. However, it can cause flatulence. Paramomycin, it is an antibiotic aminoglycoside that is used as the luminal agent. Emmetine and dihydroemmetine are effective against E. histolytica, but not available in the Philippines. So, no? It is used for patients na hindi pwedeng mag-metronidazole, contraindicated yung metronidazole. For other anti-protozoal agents, ayan, pakibasa na lang din yan. So, for your review, pero yan sobrang dami. I will highlight some of them. No? Pentamidine. So, pentamidine is anti-metabolite, no? So, it is, it inhibits the dihydrofolate reductase. Sodium glutamate and meglumine, antimony. So it is it is from antimony, no? That inhibits the topoisomerase 1 to release the oxygen-free radicals. It is the first line treatment for cutaneous and visceral leishmaniasis. Actually, yung leishmaniasis sa abroad yun, wala dito yan sa Philippines. Nitazoxanide, it is it inhibits the pyruvate pyridoxine oxidoreductase, essential for anaerobic energy metabolism. Suramine, so it is for African trypanosomiasis and a chemoprophylaxis against African trypanosomiasis. Melarsoprol is the first-line treatment for advanced CNS African trypanosomiasis. Eflornithine is a newer drug for African trypanosomiasis. For second therapy of advanced CNS African trypanosomiasis. And the Fortimox is used for American trypanosomiasis. So, tatandaan nyo lang American. Lagi nilang paborito yan si Rhodesiense at saka si Chagas species sa module 6. So, ito yung mga usual na lalabas usually. Pag ito baka lumabas, baka module 6. Kaya yan. American trypanosomiasis, mga ganyan. Kahit wala naman dito sa Pilipinas yan, talagang nilalabas nila sa Pilipinas. So, benzidazole, it is an alternative for Chagas disease, no? Bibilisan na lang natin itong viral. Okay lang. May viral ba? Wala. I-highlight ko na lang para sa Google. Dito kasi tayo nag-start kaya sorry guys. Mabilis na lang to. May viral ba akong hanap? Meron. Wala ba? O basta i-highlight. Meron yan i-forward ko na lang. Wala pala kayo nun. So, antiviral agents. So, basta ang viruses, they are intracellular parasites that replicate only within living host cells. And this is the usual structure of the virus. We have the covering and inner core. So in covering, it is composed of a protein called capsid, no? And an envelope. So yung envelope, hindi lahat available sa lahat na viruses. Kasi meron tayong non-envelope and envelope viruses. and also a cleaner for nucleic acid and other enzymes. No? So these are the classifications of different nucleic and RNA viruses. So ito nandun siya sa handout. Is forward ko na lang. Pero ito yung pinaka-important. Sige, ito pa. So ito yung pinaka-important sa lahat, no? Kahit hindi na lang aralin nyo sa antiviral. Kahit sa board exam. Kasi ito, it encompasses all. Kahit nga, ito na lang i-lecture ko siguro. So ito, so there are 4 phases kasi na viral replication. So initially, ang virus, it penetrates the virus to the cell. So viral attachment in entry, no? Then it penetrates the cell, human cell, no? Human cell, it penetrates, then it unfolds, and unfolds is envelope or group. So it unfolds and folds, it will expose or delete the virus, no? The DNA, the human cell viral DNA and RNA into that virus DNA. Then mayroong early disease, nucleic acid disease, then it will be processed, forming another RNA DNA. Kaya mahirap gawin ang HIV. Kasi there's a linking of the HIV virus and the human DNA RNA virus. Okay? Kaya mahirap siya gawin. Then it will form two virus, no? Available for packaging and assembly. Then it will the two viruses will penetrate more cells. Okay? Kaya siya, endocyte. So pala yan yung mechanism. And important dito, alam na natin ito nagpablock sa kada cell. Okay, for viral attachment are the drugs. It will be like the osagon, palivizumab, no? And penetration is blocked by HPV and HPV, no? For unfolding, it's again it prevents the unfolding of the capsid, of the virus. It is blocked by amantadine and demanding for influenza. For nucleic acid synthesis, so ito yung sa mga HIV, we give NRTI, acyclovir, phosphorus, and entecavir. For protein synthesis inhibitors, yun nga, it prevents the synthesis processing. Then, the viral release is blocked by neuraminidase. Okay, so ito, very important. It summarizes it all. Okay, so when we get in detail, so ito i-highlight ko na lang. That sa HSV infection, meron kasing HSV1, SSV, SHV2. Yung SSV1 is oral herpes, yung herpes na nakikita sa bibig. And HSV2 nakikita sa genital. So yan pala. May example pala. Kaya yun sa one, yung mga parang oral ulcers. So ito naman sa may bleeding hair. So that is yung HSV infection. Hindi masyado malinaw, no? Pero parang ganyan na. So it is itchy. Ito, herpes conjunctivitis. Usually, ito pag na yung mga baby na kakapanganak lang, tapos, yeah. And yun nga, yung mga congenital acquired HSV, actual na kapita lang na mayroong SHP pag kapanganak pa lang. So, if we have BCG infection, ito naman yung chiclet pox, no? Or it can be shingles or herpes zoster, no? So there are agents that we can treat HSV and BCG. So most of them are treated with acyclovir and ganciclovir, glucosanol and trifluridine. Acyclovir, the mechanism of action is that it inhibits viral DNA polymerase. No? So there are all synthetic analog of guanosine. So, ang nangyayari dito kasi, acyclovir, is phosphorylated to become an active drug. 3 times siyang ipophosphorylate. So 1, 2, 3. And para maging active form siya na acyclovir triphosphate. So this is the drug of choice for herpes infection, mucocutaneous and genital herpes, and for herpes simplex encephalitis. Also for neonatal SHB infection. Basta SHB acyclovir yan. Okay? So yan yung mga usual drug interaction and adverse effect. Valacyclovir is a prodrug of acyclovir. No? So ito pwede ito bigay for short herpes zoster. Pero ang available lang dito is acyclovir. Panciclovir and penciclovir. So panciclovir is rapidly converted by the first phosphatases to penciclovir. So yeah. Pero yung acyclovir lang talaga kailangan yung alalahanin dyan. Trifluridine, ito binibigay for patients na resistant to acyclovir. Okay. So for CMV infection, the drug of choice is ganciclovir. Okay, pag sinabi naman CMV, so HSV, acyclovir, CMV naman is ganciclovir. Okay? Ang goal naman dito din is to convert ganciclovir into its triphosphate form. Lagi din ganun, no? So it has a black box warning that it has an increased potential for neutropenia, anemia, thrombocytopenia. Foscarnet, pag resistant, the drug of choice for SHB and infection that is resistant to acyclovir, and the drug of choice for CMV retinitis that is resistant to ganciclovir, foscarnet. Okay, so acyclovir pag SHB, CMV, ganciclovir, pag resistant sa dalawang yon, foscarnet. Ayan, tatandaan na. Pag yan hindi nyo nasagot sa exam, tutok-tukan ko kayo. Papatok-tok na lang kayo. Yan, sige. Hina-highlight ko na lang yung important dito. Ha? Ha? Sorry. Nakailang ulit na ako, ha? So, lagi yun, as compared to acyclovir and ganciclovir that requires triphosphate, kailangan nila maging active, no? By for conversion, dapat maging triphosphate form siya. Foscarnet does not require, na maging phosphorylation, no? Di ba kanina pinakita ko na kailangan siya maging triphosphate. So, si phosphorylation hindi niya kailangan. However, it is highly nephrotoxic and not recommended for patients with creatinine clearance less than 50 ml per minute. It is also neurotoxic. It can cause headache, hallucination, and seizure. Cidofovir, ganun din naman siya. Pero yun ang important, yung mga drug of choice. Sa retroviral infection naman, no? Important na alam niyo yung combination, ilan ang combination ng NRTI sa protease inhibitor. So, the combination of choice is that 2 NRTI plus PI, 2 NRTI plus 1 NRTI, 2 NRTI plus protease inhibitor plus ritonavir, and 2 NRTI plus abacavir. Okay? So, tandaan nyo rin to kasi sa board exam namin, talagang lumabas talaga to. highly active retroviral therapy. Mali lang yung ibang choices. So, kunyari, highly active, high active, ganun lang. Kasi parang, basta yung choices nun, hindi ba iba lang, ano daw yung sabihin ng HAART? HAART stands for, yeah. Hindi, pero dapat alam niyo lang din, no? Kasi mag-exam kayo eh. Pero ito yung mga sa akin, ano ba yung HAART? Lahat yan possible, hindi naman ibig sabihin yung lumabas sa amin, lalabas sa sila. Pero, alam niyo naman. Hindi ko na ilalabas mo eh. So, there are different classes of drugs, no? That can be used for So, yan, familiarize nyo na lang yung, dapat alam nyo yung ano yung NRTI sa NNRTI. So, ito daw para maalala nyo, two scoops of rice plus chicken or beef. So, 2 NRTI plus NRTI plus NRTI. Yun ang sabi ko yan. Pero, personally ako, hindi ko pa binasabi ito for example. Pero malay nyo, maisipan ko. So, actually, wala naman ako nilagay kasi masyado dito for your exam. Mga nice to know na lang kasi itong mga to. Ang gusto ko kasi i-highlight is this hepatitis. No? Ibibigay ko na lang yung handouts ko dito. No? Hindi ko pala ito na lecture before. Pero kasi alam ko dito kayo at wala na rin kayong attention span. So, ito na lang. Please allow me ito na lang hepatitis. So, hepatitis infection, we have ABCDE, no? Pero ang available na yung treatment natin is for hepatitis A, B, and C. No? So, for hepatitis A, usually ang hepatitis A is self-limiting. So, wala naman tayong binibigay doon sa mga ganong patients. For hepatitis B, we give adefovir, lamivudine, and entecavir. For hepatitis C, ribavirin. Pwede rin yung interferon. So, interferons are natural proteins, no? That is, immunomodulate. There are types like alpha and beta and gamma. So interferon alpha is used for HBV and HCV virus, no? However, it is contraindicated for patients na mayroon ng hepatic decompensation. Ibig sabihin, mayroon ng failure of liver failure. No? And dun sa mga may autoimmune disease and history of cardiac arrhythmia. Adefovir is a prodrug of is the ester prodrug of adefovir, which is phosphorylated by cellular kinases. Ribavirin is also used as ayan. It is used to inhibit viral RNA-dependent polymerase of certain viruses. So, ang important na maalala nyo dito, pag nagtanong ng most commonly used or parang it can be used for Hepa B and Hepa C, interferon. At sagot siya. Okay. For treatment for Hepa B, Hepa C, interferon. Or pwede tayo gumamit ng mga lamivudine for hepatitis B. No? For influenza, naalala niyo yung Tamiflu dati, doon nagkaroon ng SARS. Hindi ko alam, baka sobrang bata niyo pa nun or ano, no? So, sa Tamiflu, there is Tamiflu, no? that can be used as a treatment for influenza. Amantadine also and rimantadine. Pero yung amantadine, hindi na siya masyadong ginagamit ngayon, no? Due to side effects, but it can be used for influenza A. Zanamivir, it's a neuromediated inhibitor like oseltamivir. They prevent the release of virus. Makikita niyo doon sa summary image natin kanina. It is effective against influenza A and influenza B. Ito si palivizumab. Pag nakakita kayo ng palivizumab, kasi di ba meron tayong omalizumab. Si omalizumab, para siya sa asthma, di ba? Si palivizumab, ginagamit siya for RSV prevention, no? Sa mga URTI, upper respiratory tract infection, bronchopulmonary dysplasia, and congenital heart disease. No? Okay. So, lunch break na, no? So, we'll resume at 1 o'clock. Mag-lunch muna kayo. Tapos, hopefully matapos tayo ng mga 4. Para naman makapag-rest kayo.